Our next one, let's see, this is a mental health specific question. I had to throw this in because I'm a mental health nurse, so of course I needed to include some mental health questions. All right, so here we have a nurse in an outpatient clinic who's experiencing a client who's having a panic attack. And so we're being asked, which of the following actions should the nurse take? So before we take a look at our answer options, let's just take a second to remind ourselves what panic attacks look like. So this is kind of the diagnostic criteria for a panic attack. And if any of you have ever seen someone having a panic attack, it can look really scary, right? And so these patients, when they're panicking, we think of that fight or flight system is in overdrive, right? So we're going to see palpitations, tachycardia, sweating, shaking. They feel like they can't breathe. They feel like they're choking. In short, they feel like they're dying, right? People often come into the emergency department. They're like, I think I'm having a heart attack. Like, I feel like I'm dying, right? Because anxiety can do that, and it feels very, very distressing. As nurses, do you know what our two biggest priorities are when caring for a client with a panic attack? If we think of our pyramid, our first one is to ensure safety, right? Because if you've ever seen someone who is panicking, you'll know that they are not thinking clearly, right? They have very much tunnel vision. They can't reason. There's not a lot of rational thought happening, if any. And so that can cause them to act really impulsively and could potentially put them in dangerous situations. So we want to ensure that they are safe until those symptoms of panic remit. And then the other priority that we have is to reduce those symptoms of panic as quickly as we can, because like I said, those clients who are panicking, they feel like they're dying. So we want to reduce those symptoms as quickly as possible. So with these two priorities at the front of our brain, let's take a look at our answer options and see if we can figure out which one of these are going to help us meet one of these two goals, okay? So the first one is to encourage the client to remain seated. Is this necessary? Do we need to make sure that they're just sitting there? No, this really, and it might not even be helpful because a lot of times clients who are panicking have a lot of nervous and restless energy, right? So just making them sit still might make them feel like they're crawling out of their skin, right? So we might do something, we could pace with them if they're feeling really restless. If you're in like a therapist office or something like that, if there's like a punching bag that they can work out some of that aggression on or some of that nervous energy, that would be fine too. But mostly this comes in the form of kind of walking, doing laps with the client, making sure that they're safe, helping them expel some of that restless energy. So we don't necessarily need to make sure that they're sitting. Our second option is to dim the lights and turn off the television. What do you think? I see a lot of people are kind of, it seems split between 2 and 4. What do you think about number 2? Is there a reason we wouldn't want to do this? That's a trick question. I like this option because what is a big part of reducing panic symptoms? We want to reduce environmental stimuli, right? Because if we think about this, so say someone comes into the emergency department having a panic attack, and we're in the emergency department waiting room, and there's babies crying, and there's phones ringing, and there's call lights going off, and there's nurses running around, and there's alarms sounding. Is that going to help someone feel less anxious? Probably not, right? Now, what if we took them back, put them in a quiet room, we turned down the lights, we got rid of a lot of that external noise, put them in a safe spot where it was quiet? They're probably going to feel like they have a little bit more room to breathe, right? So as much as we can reduce that environmental stimuli, the better. And so this is going to help reduce our symptoms of panic more quickly. So I'm liking number 2. But let's look at our other options because I see a couple people have picked 3 and 4 as well. So 3 is give the client privacy by remaining outside the room. What do you think? Outside the room. Now remember, we said clients who are panicking are not thinking clearly, right? They are probably going to be acting really impulsively because they can't think straight. So do we want to leave them alone? No, we always want to stay with a client who's panicking. We don't want to leave them alone. So I don't like number 3 because I don't know what's going to happen if I leave them in that room by themselves. So I want to keep a close eye on them. And then number 4, I see a couple people pick this. What do you think? Quick, shallow breaths. Quick, shallow breaths. What's going to happen if we tell this client to breathe quick, shallow breaths? If they're not hyperventilating, they're going to be. We don't want that. We want them to take what kind of breaths? We want slow, deep breaths, right? And so we might breathe with them. We might teach them how to do this. We want to slow that sympathetic nervous system down by slow, deep breaths, okay? So I'm not liking 4 either. I like number 2, and it looks like a lot of you agree. Yes, we are correct. And you can see only 49% of people in the bank got this one correct, so good job.